take attendance, and I'll hand it over to you. Amy, do you want to go ahead and hit record? Okay. Well, welcome everyone to the statewide Children's Committee meeting, the first one of FY22. My name is Kirby Fye. I'm with the department. Just a few things to go through per the Open Meetings Act. In order to keep everyone safe, especially with this new variant going around, we are continuing to meet virtual, and the meeting will be recorded and posted to the department website within the next day or two. With that being said, please make sure your phone and/or computer is muted if you're not presenting or speaking, and please state your name when asking any questions or commenting on anything, as it's helpful when capturing the minutes. I'm going to go ahead and go through attendance, and then I'll hand it over to you, Ricky. Once again, my name is Kirby Fye with the department. I'm going to go through the individuals who have joined via MS Teams first, and then I'll come back to those who have joined via phone. We have Amy Holland with the department, Amy Irvin, Avis Easley with the department, Katie Davis with the department, Elizabeth Reeve with the department, Megan Gaylord, Hunter Hancock, Jerry Moore, Jessica Mullins with the department, Carrie Virgo with the department, and our presenter today, Laretha Fentress, Lindsay Blevins, Melissa Binkley with the department, Melissa McGee. Let me see. We have quite a few people who joined today. It's exciting. Hold on. Let me go down here. Amy Olson, Ricky Harris, Tammy Summers. I caught a few names of individuals who have joined via phone. I heard Mary Katsikis. I heard Melissa Birdwell. If I didn't state your name, would you please state your name if you've joined via phone?
Alicia Smith Knight.
This is Elliot Pinsley. Oh, sorry.
Okay, I heard Elliot Pinsley. Alicia Smith Knight. Hi, Kurt.
Kayla Withrow.
Hi, Kayla. All right, I don't think I've missed anyone else. All right, Ricky.
Thank you, Kirby. I appreciate it. You guys, I'm excited about today's presentation. And Carrie, we've got a high attendance today, so I think that's because of you. I think everybody wants to hear what you've got to share, but I know that we've been talking in the committee about, the resources that children need. And I think today is really important for all of us to take this information that we hear back to our organizations or groups and committees that we participate in and share. So Carrie, without further ado, I'm going to just turn it on over to you.
All right, fantastic. Good morning, everybody. I am excited that there is such a high attendance. That's really fantastic. I'm going to talk to you all about two different things today, but really the continuation of all children's services in Tennessee. We are in a period of time where we are incredibly fortunate that we have been able to expand a lot of the things that we're doing, and that's primarily because of COVID, whether or not that's a great thing, but it is bringing some attention to children's mental health. So we're really excited to get to talk to you all. So the first part that I'm going to talk to you all about today is the system of care across Tennessee. Can you all see my screen? Can somebody just give me a confirmation?
Yes, ma'am.
Yes, we can see it.
Great. All right. So wanted to really spend a little bit of time telling you where we've come and where we're headed. And so at this point, we just wrapped up our last system of care expansion grant. We're moving into a new system of care expansion grant, which is the System of Care Across Tennessee Network. But some of the things that I want to talk to you first are about the last system of care grant, the System of Care Across Tennessee, and we are so pleased with how well that went. That grant was from October of 2016, and we actually were afforded a 6-month no-cost extension, and so we wrapped that grant up at the end of March of 2021. During that time, so when I'm talking about actual service delivery. We were not in a no cost period. You can't provide new service. You can finish up the service that you're already providing. So our plan was to, during those 6 months, to really start transitioning families to other services and supports, or if they were just enrolled right before October, we were able to continue them on and are now able to serve them under our new funding streams. But I'm going to get to all that in a minute. So just wanted to kind of give you some of the highlights of the last 4 years. We began serving families in December of 2017. That was after high fidelity wraparound had gotten put into place. And so we are proud to tell you all that we had served 333 families between December of 2017 and the end of September of 2020. So that was incredibly exciting. During the life of the grant, we were able to expand our services to cover 87 counties. We received referrals from 58 of those counties and served families in those counties. At the end of it, a majority of the referrals came from healthcare providers, and primarily when we're talking about that, they were mental health providers. So it really ended up being where we were getting a lot of referrals from other areas within community mental health centers that were referring on to SOCAT for those more intensive services. Our second group was child welfare, and those referrals made up about 75% of the referrals we got were from mental health providers or child welfare. Some of the major outcomes that we wanted to talk to you all about, we were able to see statistically significant improvements in all areas. So that was really fantastic to see. When we're talking about emotions and feelings, what we're looking at here is from the baseline score that the children and youth scored at intake to their 6-month reassessment. We were able to see an improvement in how they were handling their emotions and feelings. Some of the questions look like, are you hopeless? Do you feel helpless? What are your depressive symptoms like? And so emotions and feelings by the 6 months, everybody had improved at some point or another. And that was statistically significant. Daily life functioning, that was really, how do you get along with your family? How are you getting along with your peers? Are you doing better in school? And those areas improved as well. And caregiver strain. And for those of you who are very much on our family support specialist train, this was a huge deal in the sense that when the parents are coming to us, keep in mind that system of care is a very high level intensity service. And so the children and youth and young adults that are referred to us have been diagnosed or able to be diagnosed, and they are at risk of out-of-home placement. So these are kind of those families who are in that really top 5% of, we have tried everything and nothing has worked. This child may have been hospitalized or went into custody, has been arrested. So keeping in mind that top 5% when we're talking about this, these parents are really struggling when they come to us to be able to just function normally. A lot of the questions in the caregiver strain are related to, are you able to go to work for a full day? Are you able to do your daily activities without being interrupted by your child's behavior? And 45% of our parents were able to say that there was much less stress in their household after receiving SOCAT services. So we're very pleased to hear that. There was a 26% reduction in absenteeism in school and a 56% reduction in law enforcement involvement and arrests. 93% of the children that we served remained in their home. So again, this is very important to understand that every child that came into SOCAT was at risk of some form of out-of-home placement, whether that was inpatient, psychiatric, residential facilities, going into custody, going into juvenile detention. So that is huge when you think about the fact that 93% of those kids who were on their way out of home were able to stay at home after SOCAT services were put in place. We are so incredibly proud of that outcome. 67%, there was a 67% decrease in hospitalization due to mental health issues. 50% reduction in emergency department visits. And we all know emergency departments right now are really overwhelmed with the amount of mental health symptomology that is presenting there. They're ending up boarding these children for upwards of 30, 45 days trying to get them stabilized. So there was a 50% reduction in those emergency department visits. We're hoping that was really related to a lot of education that our care coordinators and family support specialists were giving to families to let them know that sometimes the emergency department is not your best route. Every family that comes through system of care does develop a crisis plan on day one. Those crisis plans really focusing on how do we use our natural supports to be able to help with some of the behaviors that are going on. And 94% and higher in all areas of satisfaction. So we do a satisfaction survey with our families as they're exiting. And pleased to say that 94% was the lowest rating that we had in those 5 indicators. So families seem to be really pleased with what they're getting. As a result of these wonderful outcomes, we have been able to secure another $21 million in funding for system of care activities for the next 4 years. So how did that happen? We were actually awarded a new federal SAMHSA grant for system of care expansion that began in October and will run for the next 4 years. And we were also awarded money through the Department of Human Services under the Families First TANF funding. I'll explain a little bit of the differences about what that looks like here in a few minutes. But we're really excited to say that based on this expansion, as we finished up the System of Care Across Tennessee grant, we had 12 teams in place. Today, we have 27 teams in place. So we could not be more excited about how much we have been able to grow this over the last few years. All right, so I just want to kind of give you a brief overview of what System of Care Across Tennessee, the network, and TANF look like. As far as what the families see, they're not going to really know, okay, I'm a network family or I'm a TANF family. Really, that is on our side of the house to make sure that every family that gets referred is getting what they need, whether that be from a network team or from a TANF team. It really depends on what their needs are at the time that they're presenting, what teams are available, what we've done. One of the things that we are very driven on is our use of lessons learned. And so I will say, I'll put in the chat here in a few minutes, our website. We did a project with Centerstone Research Institute on lessons learned, and some of you were able to be a part of that. And we came up with this lessons learned document of how do you really go about implementing a system of care in your state. So we always use our lessons learned for everything that we've done. And so one of the things that we learned was it was slowing down the process to have the providers have to do all the legwork for referrals. And so what we have done at this point, and Laretha Fentress, who is on the call today, is our community engagement program manager, and she is fielding every referral that comes into our office for system of care. That way she can work with the family to figure out what is their real needs, what would be the best team to serve that family. Do we have family teams in that area with availability? And if they are not SOCAT eligible, she is helping them to get hooked up with whatever services are the most appropriate and making sure we follow up with them so that we know that they got what they needed. So that is one of the best parts about being able to do this, is being able to help with that referral process so teams can really just focus on high fidelity wraparound. So the goals going into these grants, we want to continue to provide those evidence-based services and supports, and we do that through high fidelity wraparound. That is our service delivery model, which is an intensive care coordination service for those of you who may not know. But our folks who are care coordinators who are providing that service and their supervisors go through very intensive training with our trainers from Vanderbilt University Medical Center. We have, happy to say, we now have 3 coaches who are providing high fidelity wraparound coaching and training for our teams across the state. But that is one of the evidence-based services that we are putting in place. In addition, we have added a therapy component through the network, and we are encouraging the therapists that are on our teams to use those evidence-based therapeutic interventions as well. We want to make sure that we're involving families in every part of the network. You all are probably familiar with our family engagement program manager, Brenda Donaldson. She and our new youth and young adult coordinator, Morgan Morris, work very hard to make sure that we have family voice and choice and youth and young adult voice and choice at the table when we are doing any decision making and planning for moving the system of care forward. Strengthening the governance structure, Melissa McGee, who is the director of the Council on Children's Mental Health. I didn't even say that right. Yes, I did. The Council on Children's Mental Health, CCMH, sorry, y'all. But Melissa is helping us, and we're all working together to try to continue to move our governance structure forward and be able to get some of those more high-level policies in place, and really focusing on our collaborations with other departments and how do we work with them best to make sure that all of our children and families are getting what they need across the state. The other part is expanding collaborative partnerships. I'm going to get into that a little bit more here in a few minutes. Really excited about that part. And we're continuing to grow our training and technical assistance center. So really the structure for these 2 systems is we have our site teams, youth and family engagement, governance, community engagement, outreach and awareness, and training and technical assistance. So what's a little bit different about the teams that are working now is if they are a network team, this is a care coordinator combined with a therapist and the supervisor. The care coordinator in these instances, we still very much value the idea of that lived experience. So the care coordinators that are working under network do have some form of lived experience, whether that be their own lived experience as a parent or as an individual who has had mental health diagnosis, or they can be someone who is actually a certified peer recovery specialist or eligible to be a young adult peer support specialist. The TANF teams will remain the same as the SOCAT teams coming out of the last grant. So that is a combination of the supervisor, care coordinator, and a family support specialist. And as I was saying, with Laretha doing the referrals, we're making sure that families are getting to the right team that they need. One of the things that we know is we don't want anybody to feel that they have to use a specific therapist if they have a therapist who is working well for them. And so really, we're kind of looking at it from the perspective of network or TANF. We're going to make sure that you get what you need. So that's our teams. Oops, I'm going backwards. Sorry about that. High fidelity wraparound. One of the things that we always want to make sure that everybody understands is high fidelity wraparound is the service model. It is the tool by which we provide system of care. System of care is much bigger than the service. The service is only one piece. And so the high fidelity wrap, while it is very encompassing for those care coordinators, family support specialists that are doing that work, that is only one piece of the system of care. That's the service piece. Youth and family engagement. One of the things that we are also increasing with this new grant under the network grant is we are bringing back youth engagement specialists. During the very first system of care expansion, that was from 2016 to, is that right? No, not 2016. It was 2012 to 2016. In that expansion grant, we did more work in regards to youth move councils and having that youth engagement out in the communities. Project Aware has done an incredible job in being able to mobilize youth communities. Our Young Adult Leadership Council has been very successful with under healthy transitions. And so what we wanted to do is kind of bring back that youth focus. And so we will be hiring youth engagement specialists who will be working in communities to develop youth move councils and really work with groups of youth and young adults who want to bring together their community to help fight the stigma of mental health. The family engagement program, happy to tell you that this continues to expand regularly. We are seeing more and more folks that are coming out of system of care service delivery and becoming family peer support or family support specialists, which is a beautiful thing. That's really what we want to do. We want to always continue to recruit families who are at a point where they feel like they would like to give back. This is a great career opportunity for those folks to be able to have full-time employment based on their experience. And as always, Tennessee Voices and NAMI help us out with that, with the competency course. And Brenda is the certification holder for that. And so here's certifications. Very excited to let you all know that the Certified Young Adult Peer Support Specialist program is now ready to roll. Morgan Morris, who is our new Youth and Young Adult Coordinator, she is heading up that, and we will be hosting a young adult peer support specialist class. I believe it's in September. Jessica Mullins, if I'm incorrect, please let me know. But what we're right. Okay, good. So we want to get moving and certify these young adults to be able to work with other young adults. It is a fantastic opportunity to really hone in on that particular population that very much needs that support. And the family support specialist certification, we continue to move that forward. And as I was saying a little bit ago, the Council on Children's Mental Health, We are continuing our partnership with the Tennessee Commission on Children and Youth to move the governance structure to a point where we can have all of those legislatively mandated folks at the table who can help us make decisions. We're all serving the same families, and so how do we really work together not to duplicate and be able to serve more and more families? So always grateful for the partnership with TCCY. Community engagement. We are so excited to be taking this to the next level. As you may remember, under SOCAT, we had divisional coordinators. Jerry, who is on here, yay. Jerry, Laretha, and Jill were our divisional coordinators. They were housed within TCCY. And what we realized was that what they were doing was incredibly important. Attending community meetings, the Community Advisory Board or CAB meetings, health councils, all the different councils that are going on at the local level. They were able to attend those and really cultivate those community relationships. And so what we're going to do under the network is we are now hiring community engagement specialists. So there will be 6 community engagement specialists across the state who will be working in local communities, going to those meetings, doing training and outreach, really trying to develop those champions. Because if any of you know me, you know I will always tell you that system of care does not live at the state. It's got to live in the local communities. Otherwise, it doesn't work. And so we really want to cultivate those relationships with juvenile justice, the faith community, local governments, business, law enforcement, physicians, mental health. We want everybody at the table. And one of the great things is we have been doing some partnering with the Prevention Alliance of Tennessee, which is really where the coalitions live, the anti-drug coalitions. We're taking some pointers from them at how they have been able to really do that local level, getting folks on board and participating and really getting an idea about what communities look like so that we can be sensitive to what communities really want instead of coming in and saying, oh, well, we're here and we're going to help you. We really want to know what they want and need, but also being able to do a little bit of education with them to say, hey, this is why children's mental health matters. This is how it affects your community, and how can we partner to really understand the community so we can move that forward. Outreach and awareness. We have a social marketing manager who is housed at Tennessee Voices. Alexa helps us with all kinds of things. We have Facebook, Instagram, Twitter, moving into TikTok, LinkedIn, really just trying to get the word out there about general children's mental health and family topics, but also making sure that during the month of May, we're promoting children's mental health awareness and those kind of things so that people have access to resources, also through our System of Care website. And training and technical assistance. We are still continuing to provide free training and technical assistance in different areas. We are working on a quarterly calendar where we will offer regularly scheduled trainings on trauma-informed care, on building strong brains, all the different things, CANS, so many to mention, but suicide prevention, all of these different things. We want to be able to provide that to communities for free. We do have the capacity to help with the logistics of training through COVID. Benita Hayes, who is our TA coordinator, has gotten really adept at lots of different platforms, and we've been able to successfully host lots of different training and technical assistance events. And so that is something that is available to you all, that we can help in any way you need. So that really covers the system of care part. Let me stop for just a second and see if anybody has any questions there before I move into the behavioral health safety net. Okay, well, hearing none, we'll move on to the behavioral health safety net. Katie Lee is our director for the behavioral health safety net. She was unable to be with us today, so she is trusting me to go through her slides for her just to talk to you all a little bit about the children's behavioral health safety net and what it is and how you all can participate. So really this started in fiscal year 20. We received funding to expand the behavioral health safety net to serve uninsured and underinsured children, which was fantastic. It's really, safety net is providing those essential outpatient services to uninsured and underinsured Tennesseans ages 3 to 17 who meet the program eligibility. There are 14 community mental health agencies that are participating. This is an opportunity to help connect and refer those children to other behavioral health payer sources. So if a child and family comes in and they do not have insurance currently, but they, let's say for instance, they qualify for TennCare or Cover Kids, that coordinator at the facility will help get them enrolled in those programs. Each provider agency has an outreach coordinator who's doing that assistance, but also letting communities know that the safety net is available for children. For those, the eligibility criteria, they don't have any other behavioral health coverage. This was actually expanded a little bit so that children with Cover Kids and private insurance may enroll for a limited service array. They have to have a qualifying mental health diagnosis, be ages 3 to 17, be a U.S. citizen, a resident of Tennessee. My understanding is they can have been in Tennessee for 24 hours and be considered a resident. So just keeping that in mind. This is not for those that are in long-term inpatient, residential, or the state's legal custody. This is regardless of income. All children are eligible if they meet the other criteria. So those restrictions were removed. Some of the services that they can receive under safety net: assessment and evaluation, individual therapy, group therapy, family therapy, case management, family support services, transportation, psychiatric medication management, long-acting injectables, labs related to medication management, and pharmacy assistance and coordination. Prescription assistance, behavioral health safety net for kids does not cover prescriptions, but that coordinator can help them secure whatever they can in terms of reduced or no cost medications through manufacturers, so they can help with some of that pharmacy coordination. And this is the map, and it kind of tells you what providers are serving what areas. All of this is available at our website, tn.gov/BHSN, and you can get information about who is serving where. The outreach coordinators, each safety net provider has at least one. They're focusing on the prevention or promotion of the program, coordinating with child serving agencies, specifically school-based liaisons. We have Katie come present to the Office of Children, Young Adults, and Families to those teams as often as we can, just so that it's out there and people know that this is available. And it assists families with enrollment and intake. So under the first year of safety net, in 2020, the eligibility was expanded to remove the income eligibility, which I feel was a fantastic move. In April, the eligibility expanded even further to allow those that are underinsured to enroll and receive that limited array, specifically case management. In May, a statewide media campaign was launched. And then in FY21, the numbers are still coming in, but to date, 425 children have received at least one behavioral health safety net service. Some important children's facts. Outpatient mental health services are the only services covered at this time, offered by 14 community mental health providers in 136 locations in 73 counties. This does not cover physical health treatment or prescriptions. It's not an insurance plan. Helping connect someone. You can explain the safety net for children provides the core mental health services to children lacking insurance coverage. There's providers across the state for those services. You can help them identify a provider in their area by looking at our one-pager, or like I said, going to the website, and that will help you figure out who is serving in that area. The behavioral health safety net provider will determine eligibility and enrolling for the children. And they will also assist with the prescription assistance. If you have any questions about enrollment or eligibility, you can email the team at bhsn.team, TEAM, @tn.gov. They will be able to help you through there. And as I was saying, Katie Lee is our director of the Office of Safety Net, and she is available to help at any time as well. I know that was really, really fast, so I apologize for that. But that is pretty much the presentation piece. So at this point, Ricky, I'll hand it back to you. I'm happy to answer any questions anybody has.
Yeah, I definitely want to open it up for questions, because I really hope this information is, at least for some of you, there's something new here, or you heard something you didn't know today, and you're willing to take this information back out into your communities. So the expert is here. Ask away.
So this is Alicia with TAMHO, and I don't have a question. I just really wanted to commend the department for the work it's done around the Children's Behavioral Health Safety Net. The fact that you all were able to get this funding through at a time of COVID and uncertainty in our state has been amazing. And we really thank you for listening to providers and listening to the community and making the extra provisions that you did back in April. So thank you.
Absolutely. We always appreciate the feedback, Alicia. We want to know what's going on because we can't possibly know everything. So we always appreciate anybody giving us that feedback.
Hey, this is Megan Gaylord. I have a quick question.
Sure.
When we meet with a lot of our psychiatric hospitals, we have a lot of children over the course of a given, fiscal year that need inpatient psychiatric care that have no insurance or out-of-state insurance, who would meet the outpatient criteria for safety net. Is there any chance of looking to expand safety net to include like 7 days of inpatient care per child? Because you mentioned it's only outpatient. So I didn't know if there's any plan to look at expansion to help those most vulnerable Tennesseans who need that inpatient care.
I think that is a very great question, and we are constantly assessing what else can we add to this. I can't speak on it at the moment, but please do know that we are looking at some of the things that could potentially be expanded to. So I will absolutely take this back to them about hospitalizations. I think that is definitely an area right now that everybody's got lots of questions about. I'm getting a lot of calls about hospital beds and acute psychiatric situations. So please know that I am aware of that. But anytime anybody wants to bring more of that up, please email me, because the more that we can take back, the stronger the case that we can say, hey, we really need to consider this. So I will make a note of that, and I will definitely take it back to Katie.
Carrie, This is Hunter Hancock with Aim High, Tennessee, and I wanted to ask just about how transition works. Like, are you working with PRTFs or other institutional settings so that when those children are transitioning out of that facility and going back to their families, are they getting kind of automatically informed about your programs or connected with you, so that they can kind of avoid that recidivism?
We actually have been very fortunate to be able to work with some of the residential facilities to help step down, especially with SOCAT. That is one of those things that we want to make sure that we are doing, because we can potentially go in and start working with that residential facility 30 days prior to discharge, so that we can start preparing the family to receive that child home, so that that care is kind of seamless for them. That honestly is ideal in my head, what we would want to do so that we can prepare those families with all of the things that the child has learned. It's kind of one of those things that I'm very well aware of. We can make all these changes with a child in a controlled situation, but they're going back to the same environment. And the reality is, if the family doesn't understand what's been going on while they've been away, they're not necessarily always going to be prepared to bring them home. And what safeguards can we put in place before they get there so that that doesn't happen? I think that's one area that we could definitely do a little better at is some outreach to residential facilities to let them know that this is an option for them. So I appreciate you bringing that up, but I also hope that answers your question.
Yeah, that answers my question. It just seems like the perfect, a great point in their journey where there's willingness at home and there's willingness there, to kind of not come back. So,
Absolutely.
get the
Absolutely.
tools they need. So, okay, thank you.
Absolutely. Sure.
Hey, Carrie, it's Melissa McGee.
Hey.
I wanted to kind of say thanks for chatting a little bit about CCMH and our work to really move that governance structure forward, and wanted to invite all our folks that are listening to feel free to reach out to myself or to Carrie, and we can talk even more about what that means. We're planning some fun things ahead to help increase knowledge, because really our main goal with the CCMH, the Council on Children's Mental Health as governance, is to help spread the system of care values and principles that we can provide care that's family driven, youth guided, community based, and culturally and linguistically competent. We can provide care across all of our child serving agencies, and we can do that even better when we're all working in tandem together. So super excited about that. And that system of care, the heart of it is not terribly complicated at its root. It's probably a little bit more complicated to figure all that out with our practices and policies and procedures, and that